Systematic Review, Music Education, Shamika Cusack, Michael Hess, and Diana Vale. Group 4. The title of the systematic review is called Music Education for Improving Reading Skills in Children and Adolescents with Dyslexia. A bit of background information on dyslexia. Dyslexia is defined as a specific learning disorder. This disorder is characterized by difficulties with accurate and or fluent recognition and poor spelling and or decoding. Its prevalence is between 4 to 10% of school-age children. This article includes congenital dyslexia. It is considered to have a genetic component. Dyslexia is an opportunity that some children and adolescents exhibit. This disorder contributes to failure to read adequately. The purpose of this review is to investigate and synthesize evidence for the effectiveness of music education on literacy skills of children and teens with dyslexia. The methodology included databases, descriptors, criteria for inclusion and exclusion. Databases. The authors used electronic databases in May 2011 and updated them in June 2012. These databases consisted of a few: Central, Medline, ERIC, Who, WordCat. 876 total references were retrieved during this database search. Descriptors. Criteria for consideration. Types of studies and populations were the subheadings for this descriptor. Types of study: randomized control trial, better known as RCT. This included the quasi-randomized or clustered randomized trial. The population included children and teens with dyslexia who were enrolled in public or private schools. Descriptors. These outcomes were primary and secondary outcomes. The primary outcomes only included reviews that had one of the following outcomes: oral reading skills, reading comprehension, reading fluency, phonological awareness, and spelling. These outcomes were measured by the following test: Grade Oral Reading Test, Woodcock Reading Mastery Test, the Test of Oral Reading Fluency, the Graded Non-Word Reading and Spelling Test, and the Comprehension Test of Phonological Processing. The secondary outcomes were self-esteem and improved performance. The authors plan to examine the outcome data in the short term up to 6 months, medium term between 6 to 12 months, and the long term for more than 12 months. Interventions and music education approaches were also a part of the descriptors. The intervention stated students that participated in various music education approaches compared to students on a waiting list or a no treatment group. Music education approaches included individuals or group lessons with a teacher for extracurricular activities or during the school day. They were also exposed to songs, exposed to specific music methodological approaches, and practice in groups was encouraged. The selection criteria: inclusion and exclusion. Inclusion. Authors plan to use randomized controlled trials. However, no randomized controlled trials were included in this systematic review. No study satisfied the author's inclusion criteria. There were 6 studies that could have potentially been used in which they discussed musical education for children with dyslexia. However, they were not randomized clinical trials or did not incorporate reading skill outcomes. The characteristic of excluded studies. This chart shows the study and the reason for the exclusion. Banks, 1999. The main outcome is related to visual perception, not reading skills. Draper, 2007. No control group. And Fivish in 1995. A theoretical discussion, not a clinical trial. And the rest is as follows. The Prisma diagram. This diagram stated that 876 records were retrieved after duplicates removed, 876 records screened, 870 records excluded, 6 articles assessed, 6 articles excluded, 3 had no control, 1 had no reading outcome, 1 was theoretical discussion, and the other was a heterogenic sample. No studies included in this review. Levels of evidence. No studies met the inclusion criteria for the systematic review. However, the authors were looking for randomized controlled trial studies, which ASHA considers a level 1A. Quality appraisal. The type of evidence the authors sought to include were high quality, randomized controlled trials, but they could not find any studies to meet this criteria. Due to the lack of randomized controlled studies, the authors concluded that there is a lack of high-quality evidence to determine the implication of music education on dyslexic children's reading skills. Bias appraisal. The review process has low bias. The risk of bias in the included study does not apply to the review because there were no included studies. During the study selection, unpublished studies were included to reduce the chance of publication bias. During searches, no date or language limits were set, which reduced biases. The study selection was completed by 2 independent observers with expertise in 2 different areas of biology and music. In the findings, this review revealed that the effectiveness of music education could not be determined due to the lack of evidence and studies. Researchers concluded that there is no evidence from the randomized controlled trials to show possible advantages and disadvantages in improving children's reading skills in dyslexia. Findings continued. The researcher encouraged others to complete further research pertaining to the effectiveness of music education in children with dyslexia using randomized controlled trials. Future research could help determine if musical education is associated with improving reading skills and higher academic achievements and improved self-esteem for children with dyslexia. In our opinion of the findings, we believe that the findings are in line with the results of the research. The author could not find any randomized control studies that met their inclusionary criteria. Due to this, they could not find sound scientific evidence to answer their clinical question about the relationship between music education and reading skills in dyslexic children. If the authors were to make a conclusion regarding this relationship, it would not have been based on any studies or quantitative data. Additional information. Omission. It has been determined by Group 4 that several questions needed to answer the questions for Class 6070 research methods for the systematic review were not included in this presentation because the authors did not answer those questions in the research article given. Summary. The purpose of this systematic review was to determine the effectiveness of music education on reading in children and adolescents with dyslexia. Different databases were used throughout this process. 876 databases, 876 references were used, 870 of them were excluded, and 6 articles were assessed. They used primary and secondary outcomes to determine if the child met the criteria. They were then measured, the secondary and primary outcomes were then measured through the validity of several instruments. 2 authors were then selected to appraise this information. In summarizing, the authors quote, "Despite having average or above average intelligence, people with dyslexia have difficulties with accurate or fluent recognition of words and poor spelling that cannot be attributed to any cause such as poor vision or hearing or lack of teaching or motivation. As a consequence of this difficulty, children and adolescents with dyslexia may experience academic failure. Some studies suggest that reading skills and music abilities might be related and that musical training may be able to help in the development of language and literacy skills. As information about the effectiveness of music learning for children and adolescents is lacking, we search widely for high-quality evidence in the form of randomized controlled trials. However, the authors did not find any, so it is impossible for the authors to determine the advantages and disadvantages of music education for improving the reading skills of dyslexic children. It is highly recommended by the authors as well as Group 4 that you, as well as others, research this topic. This topic needs to be researched as a well-designed research project with a large number of participants to evaluate the potential benefits of music education of children and adolescents with dyslexia.